Every so often, I see a video on here that really inspires me, and I'm going to tag Dr. Jenna's account. I'm really glad that that she is huge in this obesity medicine space, and I'm really glad that she's come around with compounded. Now, she's not sitting there endorsing it, same like me. Like, we would always rather that our patient get name brand first, that we get FDA approved, things like that. However, in my clinic, if I have someone where, let's say, their insurance doesn't cover it or there are shortages, there are definitely scenarios where I use compounded medication. And one of the reasons why I just don't talk about it so broadly, it's because there are these people in the community that are so staunchly against it. And here's my thought. If you are vetting the clinic properly, if there are the correct things in place, I really think that it is not ethical, the fact that we are gatekeeping these medications to people that either have a Cadillac insurance, because we know at this point that 70% of insurances are not covering these medications. If you look at the data, how many medical problems as well as how many years earlier someone with chronic obesity will pass away, it breaks my heart. I don't think that it is right that only people that can pay $1,000 plus per month have access to these medications. The fact that shortages happen and then people have spent months getting metabolically healthier and then all of it can be gone in a few months. It's not right. There are so many issues behind this. And the reason I didn't ever make videos on this before is because I'm like, I don't just like Dr. Jenna took the words out of my mouth. Like, I don't want to die on this hill. Like, I don't want to sit here and fight it all out with everyone. But I will say that it's such a shame, the fact that we have to resort to this. Like, that is where I think the real shame is, the fact that here in the States, we pay so much more than any other country. Like, why is that? Why do we pay so much more than any other country? I understand that in some of those countries, they're more publicly funded as far as healthcare. Like, there are much larger things at play here. But I think the thing that I just a long time ago got behind is that I'm not standing for this anymore, where because someone has chronic obesity, basically told, well, you just get to be there in the corner and get super sick and ill. You get to die 5-10 years earlier. Like, I don't believe in that. I think it's unjust. And I think that we are really at a renaissance right now. There's sort of before and after these medications as far as what is happening. And I just don't believe that we should have this where people don't get access to treatment. Those are my own personal beliefs. Also, I can tell you a good point that that she brought up in her video is, she doesn't know if the side effects are different. At least I will tell you, with my patients, when I compare those on name brand versus compounded, I don't see differences as far as rate of weight loss, results that they can achieve, side effects. And again, I'm not going to get into a whole big discussion on here, but I'm just really glad that we're starting to talk about it. And I have seen a lot of people change their tune, because people were very, no compounded, no compounded. And then the reality is, when you start to actually be out there in the clinical trenches, you start to see things differently. And also once you start to get more education in this area.